Panic disorder is characterized by unexpected and repeated episodes of intense fear, accompanied by physical symptoms. I found this quote from the National Institute of Mental Health. Left untreated, panic disorder can lower your quality of life because it may lead to other fears and mental health disorders, problems at work, school, and social isolation. When describing panic disorder, unpleasant is an understatement. Panic attacks can occur whether calm or anxious, sometimes even when waking up. Panic attacks can last for several minutes or longer. People who suffer from panic disorder often fear and have an avoidance of places where attacks have occurred in the past, worrying and dreading the possibility of another attack, and discouragement or shame, thinking that they're never going to get better. Until 1980s, when the DSM-3 was written, panic disorder was looked at separately in terms of medical and psychological standpoints. Panic disorder can be dated back to as early as the ancient Egyptians, Assyrians, and Greeks. For example, in Greece, there was a god named Pan, and he was in charge of fear and anxiety, so this is where we get the root for panic. Plato had also described symptoms of hysteria that we can compare to acute anxiety, such as impeding breathing, bringing about painful distress, and causing a variety of associated diseases. The fullest early clinical descriptions date back to Aretaeus of Cappadocia. In the medieval and Renaissance era, what we would consider severe anxiety syndrome was referred to and associated as signs and symptoms of depression. Medical description of panic disorder began prior to the 19th century during a period of when psychiatry was established as an independent study. Symptoms were considered the face value, so anxiety manifestations were identified by clinical physicians, not psychiatrists. The prevalence of panic disorder can range from 2 to 3% per year, which is 1 in 10 people in the general population. 6 million American adults suffer from panic disorder, and panic disorder is 2 times more common in women than it is in men. Of those women affected, they are 7 times more likely for repeated attacks. Panic disorder can usually show its first signs in late teens to early adulthood, which is about the average of 24 years old. In children, it is referred to as fearful spells as an onset panic disorder. The prevalence of comorbidity or dual diagnosis is very common among those who have panic disorder. About half of the patients with panic disorder also have depression, and those who have a substance abuse problem, 30% of them use alcohol and 17% of them abuse drugs. Also very common is agoraphobia, which is the inability to leave familiar, safe surroundings because of intense fear and anxiety about having a panic attack outside of the home. Also common are social phobias, obsessive compulsive disorder, and simple phobias like heights, spiders, snakes, etc. Some physical symptoms of panic disorder include chest pains or discomfort, heart palpitations, pounding heart, or accelerated heart rate, which can all mimic heart attack or other life-threatening medical conditions. Shortness of breath or sensation of smothering, hyperventilating, or feelings of choking can all affect the lungs and how somebody feels like they're breathing. Sweating, hot flashes or chills, trembling, shakiness, dizziness, unsteadiness, lightheadedness or faint, abdominal distress or nausea, paresthesia, or irritable bowel syndrome are also common. Some culture-specific symptoms are neck soreness, headache, or uncontrollable screaming or crying. Some of the psychological symptoms of panic disorder include fear of losing control or going crazy, dying, disaster, or impending doom, even when there's no real threat. Also common are derealization, depersonalization, avoidance behaviors, and sometimes even becoming insane. One of the most important is that it's sudden and repeated attacks of overwhelming anxiety and fear. Not all who have panic attacks will develop panic disorder. The most common treatment option for panic disorder is the combination of therapy and medications. The most popular therapy option is cognitive behavioral therapy, which teaches to see the links between thoughts, beliefs, and actions, and teaches different ways of thinking, behaving, and reacting to the feelings that come on with panic attacks. Having an experienced professional to help you through treatment is key. Some medications that are common are SSRIs, SNRIs, beta blockers, benzodiazepines, and antidepressants. There are many controversies when it comes to discussing panic disorder. One that I'll be focusing on are the causes. Some think that panic disorder is hereditary. Genetic susceptibility is thought to be complex with many genes conferring vulnerability through unknown pathways. Basically, what this means is that panic disorder might exist in many genetic forms, each with a different genetic set of genes, or it could exist in one form with an underlying set of genes that reflect a broad vulnerability to panic and anxiety. Another factor are biological factors, such as the amygdala in the brain. This part of the brain can control how you react to fear. Other ways are thinking in a way that exaggerates relatively normal bodily reactions or the suffocation alarm mechanism in the brain. Another cause could be the personality. So, those who are more prone to anxiety are more likely to believe that anxiety is harmful. Stressors and interpersonal issues or stressful life events, such as a death in the family or adverse life events in the months preceding a panic attack, can have a huge impact on panic disorder. Another controversy of panic disorder are the differences between anxiety attacks and panic attacks. Anxiety attacks usually extend over a longer period of time, and some symptoms include racing heart rate, knots in the stomach, muscle tension, disturbed sleep, difficulty concentrating, fatigue, or restlessness. Panic attacks usually have a greater intensity and duration of symptoms. They can peak in 10 minutes or less, but they can also last for up to 20 minutes. The resulting anxiety from a panic attack can last for hours, and recalling an attack can trigger a new one. Some symptoms include shaking, chest pain or discomfort, heart palpitations, fear of dying or losing control, or the feeling of choking.